Naturalhealthcare.ca, Canada's guide to complementary and alternative healthcare. Hi, welcome to Vitamin Junkeys. I'm Jennifer Lyall.
I'm Dr. JJ.
And we're addicted to good health. Today, we're going to be talking about constipation and staying regular. But before we do, we're going to see what JJ's taking today.
That's true. And before we do that, this is a very important episode because this is episode number 29, which matches Jerome's age. And this means something, right? In your 29th episode and your 29th year, or in your forget it. Moving along, so only we will find that funny. I am taking magnesium. I take magnesium for a number of reasons. I take it for muscle spasms. I also use it in patients to help decrease their blood pressure. But it's also a very good treatment for constipation. So a lot of my patients are chronically constipated. I will give them magnesium. So there we go.
I once took too much magnesium. I take it in a powder format, and I was measuring it out, and I dumped too much into the water that I mixed it in with. And I didn't feel so good, and I was going to the bathroom a lot.
Yeah, you would find it's a very expulsive treatment. Yes.
Laxative. It's like milk of magnesium.
Explosive, thank you.
Yes, explosive. That's
very
very
explosive treatment. Yes. You don't want to take too much of magnesium.
No, and I learned that the hard way.
I won't touch that. Jane, moving along, yes.
So, JJ, can you tell us what exactly is constipation?
Okay, constipation is when you're not having regular bowel movements. There's a lot of misunderstanding in terms of what people think what regular bowel movements are. When I ask patients, I'll say, are you regular? They'll say, oh, yes. And then I'll get to more details. So are you going once, twice a day, 3 times a day? You were saying in your opinions 2 to 3.
2 to 3.
For me, it's about 1 to 2 a day. But I'll have patients that'll say, oh, no, once a week. I have some patients that go every 2 weeks. That's not regular. That makes you constipated.
Wow, that's pretty scary to think of how much is accumulating in your body.
Oh, yeah, definitely, too. Ugh. Yeah, no, not healthy.
So what are some of the causes of constipation?
In some cases, there could be something organic going on. Some people could have some form of pathology that's causing some constipation. Dehydration. Definitely, if you're dehydrated, predisposes you to constipation. Certain drugs, any form of opiate, so morphine derivative or Tylenol 3s, which have codeine in it, will constipate you, so you have to be careful with that. And other medications have constipation as a side effect. Diet, stress, there's a number of things that could add to your constipation.
Wow. So what are some good ways to keep things moving?
Drink water, very important to keep things moving. A well-balanced diet that's high in fiber. Definitely, so you want a lot of fruits and vegetables in your diet. Treatment-wise, my four or five main treatment things that I tell the patients are water, probiotics, fiber, and magnesium. Those are the main things I give to patients for treating constipation. So probiotics are your acidophilus, drinking a lot of water, fiber, and magnesium. Those are the main things I give.
Is there a guideline of how much fiber we should be getting every day?
There are. I don't know the number off the top of my head, but you should try to aim for I would say have some fiber source every meal. So in your 3 meals a day in your snack, try to add something more fibery. So try to include your fruits and vegetables, and you could go and take a fiber supplement or add, for example, ground flax.
Yeah, I take that, and that really helps me tremendously.
Yeah, or ground hemp, or there's a lot of people that just sprinkle stuff onto their cereal. But I don't do that, and I have no issues. I just eat a lot of fruits and vegetables. I eat a lot of raw foods and vegetables. That's causes no problems.
And it's interesting how different things work for different people, because I have tried other things, but I have found that really ground flax is the thing that works best for me.
Yep,
and the essential fatty acids, does that play
a
role at all?
Oh, that's good. Thank you for reminding me of that. Yeah, also fatty acids too. People that are deficient in fatty acids, so things like fish oils or flax oil, etc. Also giving them fish oils, for example, will actually improve people's bowel movements. That's another one too that I sometimes give. It all depends on the case. You kind of tailor it, but yeah, that'd be another one to throw into the combo. If you're looking for a treatment, I don't often give people laxatives, herbal laxatives. There's a number of them out there on the market. Cascara is probably the most common one that you could get in a tea or in a tincture. So tincture is an alcohol extract, or in a capsule. I don't usually give that to people. Normally we fix it with magnesium, fish oils, water, probiotics, and fiber, so we don't usually have to go there. Some people use psyllium husks, right? That's another way of doing it. Just be careful with your fiber supplement. If you take a fiber supplement with minerals and some medications, the fiber supplement may actually prevent the absorption of these minerals, these nutrients, and these medications. So if you are going to use a fiber supplement, take it a good hour to 2 hours away from your medication.
So that's a really good reason of why you should really work with your healthcare practitioner to design something that's going to work with you, taking into consideration how regular you are personally and any medications you might take for other conditions that you're treating. That's fantastic.
Yeah.
Well, if you are looking for a naturopathic doctor, you can click on the Find a Practitioner link on our website, www.vitaminjunkies.com. And while you're there, don't forget to join the addiction, where you can subscribe to Vitamin Junkies and you'll receive notification of whenever a new podcast is released. I'm Jennifer Lyall.
I'm Dr. JJ.
And continue the addiction to good health. Here's to number 2s.
Do, 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 do. Do, 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 do. Do, 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 do.